Hello, my name is Dr. Gbolahan Agbeyangi, and I work for Renal Dialysis Center. It's an outpatient dialysis center here in Lagos, Nigeria, that takes care of people who have kidney disease. Okay, what is kidney disease basically? Kidney disease occurs when the kidneys cannot function to its normal capacity. The kidneys are two lovely organs, a set of paired organs somewhere at the back, the lower part of the abdomen at the back, and their functions are several, but I will mention a few. The kidneys remove excess water from the body. The kidneys remove waste from the body. The kidneys help to make blood, and the kidneys also help to control blood pressure. As well, the kidneys also supply some certain hormones which help to control bone and its metabolism in the body. So if the kidneys are affected, all these options, all these functions are affected. Kidney disease actually is broadly classified into two types. You have what you call acute kidney disease, chronic kidney disease. Acute kidney disease occurs over a very, very rapid period. There's a rapid deterioration in kidney function, while chronic takes time. Acute kidney disease can happen over several hours, into days, into weeks. However, chronic kidney disease takes a lot longer. It's a bit more insidious, it's a bit slower, from weeks into months. In both cases, what happens? The kidneys function start to deteriorate, and as the kidney function starts to deteriorate, the body cannot remove waste, and when that happens, the person ends up having what you call kidney failure. There are different causes of kidney disease. The most common causes of kidney disease worldwide are: number one, diabetes; number two, hypertension; number three, you have infections like glomerulonephritis, infections like HIV, infections like hepatitis. You also have kidney disease that is due to genetic causes, in which it is passed on from one family member, a father, a mother, to a child. You can also have kidney disease occurring from people taking, medication that they should not take. For example, people who take chronic ingestion of certain painkillers that should be prescribed. And then in this part of the world, you have people who take a lot of herbal medications that are unlicensed and they don't know what is in them. So all these things together, roughly, they all contribute towards causing kidney disease. In most people, unfortunately, kidney disease, the symptoms are not obvious. By the time the symptoms become obvious, it's actually quite advanced. But most of the time, what you see in such people is that they get tired very easily for no reason whatsoever. All right? You notice that the urine starts to become reduced. The quantity of urine, the volume starts to reduce, or it becomes too much. All right? You find people not being able to eat. They are anorexic. There's a lot of nausea. There's vomiting. Sometimes they have this particular odor from them. What happens is that the levels of the waste products rise so much that it becomes obvious in their breath. And in very extreme cases, you can find people who become very, very agitated. They become restless and become, in some cases, unconscious. And if it's not arrested soon, most of those patients end up dying. Again, kidney damage, like we said, to the most part, doesn't show up. It doesn't have any symptoms. It's not obvious. So most people, the only way you can really prevent it is to get tested. What doctors usually tell people to do is this: speak with your doctor. What you should do is you should run some certain simple tests that are inexpensive, they're not expensive, and they can help you to find out what your kidney function is. That way you can find out if you are at risk of kidney disease or not. The risks of kidney disease are several, but basically, number one, if you are diabetic, you're at risk of kidney disease. If you're hypertensive, you're at risk of kidney disease. If there's a family history, if there's a family member who has kidney disease, you're at risk of having kidney disease. You have people who smoke. Smoking is a risk factor for kidney disease. People who are overweight. If your BMI is more than 30, you're at risk of having kidney disease. You also have people who work in certain factories, people who are exposed to chemicals, people who are exposed to things like rubber and the tanning industry, where they have a lot of these chemicals. People who use a lot of mercury-containing soaps, mercury-containing creams, all these bleaching creams, they are at risk of having kidney disease. All right, so the best way really is to avoid these things. There are some things you can avoid, some you cannot. Family history, unfortunately, you can't avoid that. But things like staying in a healthy weight range, avoiding becoming obese, you need to do that. You need to eat healthy. You need to make sure that you take less alcohol. You need to make sure you stop smoking. You need to make sure you exercise more, you stay physically active. If you do those, and then as well you see your doctor and you discuss with him about running kidney tests. Kidney tests, like I said, very cheap, not expensive, and they make you understand if you are at risk of kidney disease. If you do have kidney disease, you can be taken care of quite readily. What you call a BMI is called the Basic Metabolic Index. It's just a way of trying to classify whether you are obese or not. For certain age ranges, for certain body types, there's a certain weight you have to stay in. Basically, you have people who are what you call normal weight range. That BMI is what is in the range of between 20 and 25. What BMI simply means, in simple calculation terms, is your weight in kilograms divided by your height in meters squared. That gives you an index, gives you an average range. The normal BMI range is, like I said, is between 20 and 25. However, people above 25, they are classified as obese. Now, if you fall within the range of 25 to 29, you are obese. You are overweight, and anything above 30 is obese. 30 to 35 is moderately obese. 30 to 35 is mildly obese. 35 to 40 to 39 is moderately obese, and anything above 40 is severe obesity. So that's that. Yes, like I mentioned before, kidney disease can be inherited. There is a class of kidney disease, they call it polycystic kidney disease, or PKD. All right, those forms of that classification of kidney disease is something that can be inherited from a parent. You have other kinds of kidney disease that can be inherited, but that's the most common cause. Reach me at Renal Dialysis Center. We have two centers here in Lagos, Nigeria. The first one is at 19B Adeboye Solanke Street off Allen Avenue in Ikeja, Lagos. The second is on 319 Ikorodu Road by Nigerian Life Pensions on Anthony. Okay, my numbers here: 0903 063 9422. I say that again: 0903 063 9422. You can reach our general inquiries number on 081 0 in 5 places, that is 0000178. I take that again: 081 0 178. We're also on Facebook. You can check us out at Renal Dialysis Center. We're also on Instagram. You can look at our pictures there at Renal Dialysis NG, as well as on Twitter at Renal Dialysis NG. Thank you.